All right, well, good afternoon. Thank you all for being with us this afternoon. This is a continuation of our Return to Rowan series. We certainly appreciate those of you who have been with us before. And those of you who are new to the series, this is our way of kind of putting a personal touch to some of the information that we've had on the web. Lots of really good information, but we received some feedback some time ago that it was kind of a lot to process. And so we've had a series for the last 2 months where we've kind of put some verbiage to that and had some amazing people come on to our session and talk to you all, and today is no exception. So I'll introduce our panelists here in just a second. But for those of you who are not familiar, we cannot see you or hear you. We certainly apologize for that. But if you do have questions, we certainly would love you to type those in the question section, which is off to the right-hand side of your screen. I promise you we will try to get to as many of those as humanly possible. The other thing is, as amazing as Scott and Amy are, they may not have the expertise to answer your question. So if there's something that one of the three of us can't specifically answer, we certainly will refer you to the right source or try to get back to you in an offline environment. So again, thank you so much for being here. I'm going to turn things over to Scott Woodside and Amy Hoch. They're here to talk to us kind of about life in COVID world. What happens? We've all read media, we've all heard stories, and so they're going to talk to us. One of the things that I think is incredible, and I just want folks to know this comes sincerely from my heart. I've been around student affairs and college life for 30 years, and you got two of the best in the country right here, whether it's a physical well-being, a mental well-being, some people that just care about our students. You will have no better than Scott and Amy. So I'm going to let them do a quick introduction, and then we will get to questions. Thank you again for being here.
Thanks, Kevin. I'll jump in here. Very nice introduction, and again, the feeling's mutual. This is a love fest. So thank you, Kevin. I've appreciated working with you, and you'll love hearing from Amy for sure. So for those of you that have listened to this presentation or my presentation regarding health and wellness and public health on campus, I apologize if I'm repeating myself, but I want to make sure that we're getting the messages out. For those of you, we have currently 90 participants that are listening for the first time. So my name is Scott Woodson. I'm the director of the Wellness Center. So the Wellness Center is on campus. Winans Hall is where most of what we do in the Wellness Center lives. We have student health, we have counseling services, healthy campus initiatives, pet therapy, and EMS, which we oversee here. It's a great integrated team and all available to all of our students. So it's important that you know what resources you have available to you. So please go to our website, check it out. But I'm going to talk specifically about COVID and pandemic related issues and what's going on campus. I'm going to start off real briefly with a couple opening statements, just so you have some background of what's been going on. Really, for the past almost 8 months now, we've been meeting very regularly on campus. Kevin and I are part of that team that meet consistently. If not weekly, Kevin and I talk daily, to be honest with you. But that team is across the campus. It's made up of both people that manage operations and leaders and up to the president's office. So we've been very closely working together on monitoring and making decisions, including information from all of you and our leaders across campus and our faculty and our staff. So we've put together what we believe is the most latest public health recommendations, really with a focus on your health and all of our employees and students and staff across campus, our health and well-being, really with a focus on the most vulnerable. That was really what's been driving us. So we're looking at this from that lens. And that's what's important to remember. The main goal of all of our plans is to remain flexible, and we'll talk a little about that as we go through this this virtual session. But really, that's what's that's what's driving Rowan Restart is, the health and well-being of all of us, our campus, our universe, our family, and focusing on the most vulnerable. So campus is going to look very different. I have to be very clear about that. This is not going to look like, those of you that are returning students on this video call, it's not going to look like last year, and everyone I think realizes that. But specifically, where you're going to see different are the policies that we're putting in place to protect you from a public health standpoint. So all the social distancing measures that you've come to grown accustomed to for the past 6 months will be in place. Desks will be 6 feet apart. and any lounge areas, they'll be separated. You'll be asked to wear masks on campus almost at all times. If you're in groups outside, you should be wearing a mask. The only time that masking is not enforced is when you're in your residence hall, or for our employees, if you're in an office by yourself where you don't expect visitors. So otherwise, expect to be wearing a mask, and I know all of you have been doing that. But we will be providing you a really cool mask when you get to campus. It might be show and tell time. So Kevin will be displaying the mask. Very nice. You're my white today. Yes, thank you. So masks will be required. All of our traditional lectures will be also available virtually. So it's a key part to this. So you know, we can certainly answer some questions about the academics, but that usually is covered in some of these other sessions. But I can tell you, in working very closely with the provost, that he and his team have been very diligent in making sure that students will have access to everything as much as humanly possible in a virtual environment. And the reason is, in case you as a student for some reason cannot come to class, for an example, let's say that you know someone that has been exposed and you're now a contact, and we ask you to quarantine for 14 days. You can still get that content. You can still keep up with your classes in that scenario. So we needed to make sure that we're protecting you and we're protecting our faculty as well, some of which may be in that vulnerable category. So that's the other reason why we wanted to make classroom environments as virtual as possible when necessary. But we will have in person as well. So all that has been explained and is rolling out as we get closer to the opening of classes next week. So you'll get more information specifically from your professor on that. But really, the main message that I'm going to drive home right now is that the success of our restart and how we're doing is not just a student is holding that issue. All our students are a key component to that. It's on all of us. So Kevin, Amy, myself, everybody, it's on all of us to make sure we're doing our part to make sure we are not creating an environment where we could potentially spread COVID. So that's very, very important. And we hold that dear. And that message we've been reverberating through campus for the past few months now. And we hold that, and we hope you hold that as well. And a little bit, I'm sure there'll be questions about testing and isolation on campus, which I'll be happy to get into. And also, we want to talk a little about what mental health and medical visits look like on campus. But I wanted to hand it off to Amy to do a brief introduction, and then we'll dive into some of those closer details. But I'm really grateful that the 115 of you joined us. Thank you so much, and I think you're fulfilling Kevin's dream of being a VJ. I think he likes being up there moderating and rocking out. So all that's to the plus. But I'm going to hand it off to Dr. Hoch to introduce herself.
Thanks. Yeah, we do look good in headsets. I've gotten very used to this look. So good afternoon. I'm Amy Hoch. I'm a psychologist and the associate director of the Wellness Center. And, you know, as Scott's focus has been primarily on physical health, mine is really on mental health. And both of us, all of us here on campus, really look at it as two components within 6 overall components of well-being. And that's really our focus here as students start to come back onto campus or come to campus for the first time, is right to really balance the needs of physical distancing that we have right now, that we need to keep, with also the increased vulnerability that we know young adults already had before both pandemics that they're experiencing have happened. We know that mental health issues were on the rise, and with both of these pandemics, we have seen students' needs increase, their vulnerability increase. One area in particular is social connection, right? Being more isolated just by virtue of physical distancing. And so one of the things we know, and one of our messages to students is really about how social connection is the best predictor of well-being overall. And so part of our focus is, even though we may have to maintain physical distancing, how do we create a sense of belonging on campus for our new students? How do we create community? How do we, you know, balance social connection with social responsibility in terms of, right, coming to campus and keeping each other safe? And And then also really looking at the ways that the Wellness Center can support that, that student life and student affairs can support that, so that students can be safe and have a really good experience while they're here. Certainly, the Wellness Center and we'll talk more about these specifics, but we are offering 15 to 20 groups this semester. We're offering workshops for students. We are offering through our health promotions department a variety of different ways to meet people, connect, do health programming, get out on campus and meet people again in safe ways. And we have our pet therapy appointments that students can make both virtually and in person in safe ways. And so I think there are lots of ways for students to connect with people and to really thrive even under these conditions that we're in. So I'll turn it over to all of you to ask some more specific questions, but I think that's really, my main message.
Great. Well, thank you both for starting us off with that excellent information. So a number of questions coming through. Again, if you are a participant, please feel free to ask your questions on the question and answer in the question and answer box on the right-hand side. But I think the first question is a good one. There's a participant who has said they're scared. They're scheduled to move in and they're scared to do so. So how do you deal with that fear of I'm excited to be here, I want to be here, and I'm ready for my Rowan experience, but I'm scared?
Well, I would say that the fear is legitimate. I would say to validate that, it is scary and exciting at the same time. I don't think you have to, necessarily try to just avoid that feeling or somehow feel like that's a wrong feeling to have. Because I do think there's again, that idea of social responsibility, right? And the ways in which we probably have to act different. And we hear a lot in the news, right? We hear a lot about what's happened in other schools. Certainly that can increase our fear. So what I would say is fear is not necessarily a bad thing. It communicates to us that we need to pay attention to things, right? There's something that is potentially a threat or is a threat. And sometimes it's hard to know the difference between those things. So the other thing I would say to kind of balance out your fear so that it doesn't become so huge, right? And kind of so out of control that it kind of overwhelms you is that be careful how much you're watching the news, how much you're on social media, how much you're taking in from sources that aren't giving you accurate, legitimate, right, information about things. And to be doing those other things, connecting with people in your life that you trust, that you love, that care about you, that are going to offset that fear. And certainly we're here for you. I think you can always call us. You can always, right, make an appointment online to talk to somebody if you feel like that fear is getting the best of you, because that certainly happens to all of us.
That's sound advice, Amy. I would echo that and double down on what you just said. I would also say that a lot of times for me personally, fear is driven by, my knowledge on the situation, and what do I know about it or what do I not know about it? And those are on either side of that spectrum, can generate fear for sure. If your fear is of the unknown, please go to credible sources. Amy mentioned news a couple times in her response. I would argue that most news is not where you should get most of your information. However, it's hard to know what to trust, right? I would say that the expertise that we have on campus, the information that we put forth in the Rowan Restart is a good place to go. I would say that could be maybe a starting spot for you and then go out from there. CDC typically is a place that I trust to get good, valid information. A lot of times what you're going to see in the news is one-off studies or very small studies or something that really scares me sometimes reading some of the studies that come out. But when you look at the CDC and the National Institute for Health, the World Health Organization, those tried and trusted organizations that we know look at research studies that have been duplicated and verified by peers, by journals of peers. So I think it's important to make sure you know where to get good information. We're not going to put anything up on our website that we know isn't trusted and valued. We have a very, very good connection with both the local and state public health officials. So it's really almost on a daily basis. I'm in communication with them. We are really doing our best to work with them and making sure we are doing what's right in terms of public health, knowing that we have to be flexible and adjust as new information comes out. We are trusting science, and we are trusting what our experts are saying in that, but we are also making good sound decisions and ability to be flexible at the same time. So if your fear is that of the unknown, there are places where you get good information. If your fear is of the known and what's out there, as Amy said, we're here to help. We're glad to support you in that. And there's any number of ways. And I encourage you to go to our website where we have lots of good information out there on how to access resources.
And I would really echo what Amy said about relying on trusted sources and support that you have in family and friends. The other thing I would say is, even external to the COVID world, this thing we call college life is stressful, and it's listening to your heart. Sometimes we get into the business of, I'll compare myself to Scott, or I'll compare myself to Amy, and they may be saying, oh, life is wonderful and I'm not feeling that way. Listen to your heart. Be honest with yourself and reach out. We've got fabulous resources, be they in the residence halls, be they in the Wellness Center, all over campus. Make sure that you're reaching out and asking questions and being honest with yourself, because college is stressful without COVID, and you add that on, we really need you to be honest with yourself and with us, and I promise you we can help. So obviously one of the common questions that keeps coming up, Scott, is related to testing.
Mm-hmm.
So I don't want to multi-layer the question too much, but obviously there are lots of questions out there of, is Rowan going to require a negative test before people could come to campus, and what's our overall plan related to testing?
So if I could sum up testing in a few words, ultimately I'd say it's multifaceted. So there is no one surefire way. If you are watching the news at all, you'll know that you hear a lot of different experts talk about testing and say multiple different things about it. What I can tell you is that, having run the Gloucester County drive-through testing site and actually done testing here on campus, and also I'm a former public health director, I can tell you that testing is variable. And so that's why when we were coming up with our strategy, we wanted to make sure we are only looking at testing resources that are both very effective and valid. Right. So what we saw in the news before is that there were a lot of test products that came out, and there was a lot of false negatives and a lot of false positives. And to be honest, you're seeing that now. I think if you watch the news from the NFL and Major League Baseball, there was a series of false positives and false negatives. So testing, I would say, is not the end all be all. Testing is a tool that we use in medicine to either verify a clinical judgment that we're making or a decision, or it's used as a screen. I think the universities that are choosing to do multiple tests in a series, I don't think that's a terrible strategy, but I think it leaves openings, right? And it causes some false reassurance. If you know anything about COVID, we know that there's an incubation period of 14 days. So for us to test someone, that does not mean that they will not eventually be infectious. So I think any approach that a university has, and our approach, is that we're looking at it both from the asymptomatic, which is those people that do not have symptoms, and the symptomatic. We're going to be doing asymptomatic surveillance of our residential students every week. So every week we're gonna sample a population, a segment of the population, to try and identify any asymptomatic cases that may be present on campus. We're also going to focus heavily on the symptomatic cases. So if a student has a complaint of a fever or a sore throat or a cough, we are most likely going to rule them out for COVID with the battery of tests that we'll also do for them. For example, if their main complaint is a sore throat, we won't just do a strep test, we'll also test for COVID. So we are going to do as best we can to identify anybody with symptoms so that we can rapidly isolate them and identify close contacts, which I think is the main way in public health that we can mitigate the spread. We know that in New Jersey, the transmission rate is extremely low right now, and we're going to do our best to keep it that way, in addition to the testing, all the public health initiatives that we're putting in place that we mentioned earlier. But so through asymptomatic and symptomatic testing, now I think I'm rambling on a little bit, and we can maybe explore later when some questions come up, but we're going to approach it from that two-pronged way, and we're only going to be doing testing that is high level. It's called PCR. It's a lab quality test. We're not doing screenings. So we're going to cut down on some of those false negatives and false positives. I don't want to get too technical, but I want to make sure I'm thorough in answering the question. But that's kind of how I start right now. Then we'll see where we go from there.
Great, thank you. And just as a quick follow-up, and Scott, I promise you, I'll give you opportunities to take a breath and get a drink every once in a while.
No
But
problem.
lots of questions about, okay, so what's the process? So if I'm a student and I don't feel well, maybe I've got a fever, or maybe I've got a sore throat, who do I tell? And then what's the process for quarantine? Is my roommate going to have to move out? Am I going to have to move to Triad? Can you talk me through that process?
Absolutely. So let's start with the identification part of that question. How does a student make it known that they have some type of symptom? Well, so we have a 24/7 process currently. So students can contact us at the Wellness Center during our normal operating periods, which next week starts 8 a.m. to 6 p.m. Monday through Thursday, 8 to 4 on Friday. And we'll have nurses available to take those calls and triage with students over the phone. If we feel that they need to be screened for COVID, we'll start that process. We're doing testing twice a day, Monday through Friday. And on the weekend, we're working with Inspira to do some rapid testing as well. And then we'll follow up with those students appropriately in terms of testing after that. But the intake process really starts with that initial phone call. So a student would call, as they normally call the Wellness Center when they have any type of illness, and we will schedule an appointment. It'll typically be a tele appointment to rule out any other, maybe some co-occurring symptoms to find out if we have to do additional testing. We've set up a testing facility at Hollybush Mansion on campus. So on campus, we're doing testing twice a day, Monday through Friday. And we will direct the student there. We'll collect the specimen. And in most cases, in our on-campus population, we're going to be getting results that day. If we do have to send a swab out, the test results turnaround time, I just checked with our vendor, is 1 to 2 days. So at most, we're looking at a 2-day turnaround currently with the way the labs are set up. But we're also going to have a machine that we'll be using to do some rapid testing. So we should be able to get some hour level turnaround time that'll be up and running soon. So we have multiple ways of getting test results. And ideally, right now, we're looking at a 1 to 2 day turnaround tops. So that intake part starts with a phone call from the student. We've also trained all of our RAs to recognize what the symptoms are and to guide the student into contacting the Wellness Center. Students may also contact an urgent care or their primary care provider. But what we do ask in terms of Rowan and keeping Rowan safe is that if there is a known case, if a student does get tested and it's not by us, please call the Wellness Center so that we can keep track. Another initiative we have is training contact investigators. And I know this wasn't the question you asked, but we're going to do our own contact investigation on campus. So please, 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 if we call you, it may be me, it may be one of our highly professional staff that I've trained. Please take the time to take that phone call and answer our questions and be truthful so we can identify people who you may have been in contact with. What was the other part of that question, Kevin? I think I digressed a little too far.
Just talking about the quarantine process.
Oh, the quarantine process. Right.
If my roommate is positive, do I have to move out? Do they move out?
Yes, that's a great question. So let's walk through a scenario. So a student is moved in, they're on campus, they do have a roommate. They come to us, we test them, we have a positive result. So at this point, they're a confirmed case. That student will have to isolate, whether that's off campus in their home, in some other off-campus environment that we work out an arrangement for, or we've identified Triad on campus that we're prepared to move students to for the duration of their isolation. We would notify the roommates and any other close contacts we identified through the investigation process. And make them aware as well that they need to quarantine. Now, a roommate can quarantine in their room. A roommate that's quarantined is not infectious. If they do develop symptoms, then that's a different story. We would certainly test them to identify if their symptoms are related to COVID or not. It is possible that people do have symptoms that aren't COVID related in a pandemic. We certainly do have a number of infections that could happen, especially as we head into the fall season and winter season. So we want to make sure we do rule out COVID if there is ever a question. But students that are quarantined, for example, we have a number of students that are quarantined currently coming from states that New Jersey deems as a higher risk. So we have asked them to come earlier to quarantine so that they're prepared to go to on-campus events in 2-week time. But students that are identified as a confirmed case will be isolated outside of the residence hall into either triad or their home or off-campus location, and that'll all be coordinated at that time. And it's we're going to really take our time with students to make sure they're comfortable with that decision, and we're going to work with them very closely. If a student is isolated on campus, Kevin and his team and my team are going to pay very close attention to them. It's not like we're going to lock someone in a room and we'll see them in 14 days. It will not work that way. So we're going to make sure that students are comfortable, they're properly fed, they have what they need. We have our behavioral health consultant program that Amy can talk about that will be available to them to reach out if they do have any mental health concerns. Multiple points of contact from RLUH as well. So students we're doing our best to make sure we're addressing students' needs on campus if we have to isolate them.
Yeah, so I'll just add that, as Scott mentioned, for any student who's in isolation at Triad, one of the counselors, the behavioral health consultants, we call them, will reach out to that student by phone and set up a contact with them to provide some information, to talk about resources. They'll also get something, a bag of self-care kind of products, if you will, and some of the information we put in there is directly related to mental health resources. One example might be we have a therapy assisted online program that any student can access at any time, regardless of whether they're in isolation or not, but it is something they can access on their device that they can use to, access mindfulness exercises, relaxation, exercises that kind of help with, anxiety provoking thoughts, and other resources as well. So that's just one option for students, but know that we will make contact with students, and those who want it and who may need ongoing support, we can provide that as well.
Great. And Amy, can you talk a little bit? So let's say that I have some stress or a mental health concern at 3 o'clock in the morning. Do I have to wait until the office opens at 8 o'clock the next day? What happens overnight?
Yeah, so, obviously, if it's a level at which something like a therapy assisted online is accessible 24/7, you could certainly use that. But we also have after hours on the weekends, anytime we're not in the office, we have a service called Protocol where you can reach a counselor at any time. You can talk to that counselor can assess you, talk to you about any issues that you have. And then we always follow up with that student the next day, those of us who are actually here on site at Rowan. So it is a service that we pay for, that it is accessed at any time, but we specifically then follow up with students who to just see if they're okay and see if they want any additional support.
Great, thank you. Scott, I think one of the things that might be helpful from some of the questions I'm seeing is making the distinction between quarantine and isolation. So there's a question: if I'm in quarantine, can I go get food? Am I just locked in my room for 14 days? Can you talk a little bit about that process?
Yeah, sure thing. So the textbook definition that you'll see between quarantine and isolation is: quarantine is for those individuals who we're not sure, they may have been a close contact, they may have traveled to an area, they may have been exposed in some way, but are not infectious, they're not showing symptoms that we know of. So they're in quarantine for a period of typically 14 days from a point of exposure, right? Isolation is different. We use isolation in association with students who are a confirmed case, or patients that are a confirmed case. So the main difference is one is potentially infectious and sick. The other is we're just being cautious and trying to insulate the case so that we don't have spread. So it's really important in either case, if you get instructions, to make sure you are isolated or in quarantine, that you do not have exposures. And exposure is typically defined as being within 6 feet of someone for more than 10 minutes, mask or no mask. It does not matter. So if someone fits that description, they're now going to be considered a close contact to a confirmed case. That's very, very important. So what we're trying to do on campus is trying to minimize those conditions where we are within 6 feet of each other for more than 10 minutes. Now, we know that that's impossible in some cases, and I see that there are some questions related to how we're doing that. So we can talk maybe a little bit about that, but that's really the main difference between isolation and quarantine. Did I answer the question fully, Kevin? Or is there something else?
Yep, that's perfect. A couple of quick hitter items. We know there have been lots of discussions about COVID and flu kind of having similar symptoms. Will there be a flu shot process this year? What about when the flu comes to town?
I love that question. When the flu comes to town is my worst song that yeah. So, yes, absolutely. We've actually done a pretty good job of offering flu vaccine to our entire campus. Last year, we gave out well over 1,000 flu shots, which is really a decent percentage of the population. We also have great partnerships off campus. Our county health department does an amazing job offering flu vaccine. They'll be partnering with us this year. We partner with some local pharmacies to help bring as much flu vaccine to the campus as possible. So there's a number of ways that we offer it. We're going to be doing differently this year is we're adding drive-through programs. So students or faculty or staff will be able to get their flu shot in a drive-through experience. I used to run the flu program for the county when I was with them 8 years ago. It's really an amazing process, and it's a great way to enforce social distancing. So in addition to our normal clinics we'll offer some outdoor, spaced out, scheduled flu clinics. We are in addition going to be doing some drive-through clinics on campus, which will be a lot of fun for me to run and actually an enjoyable experience for the participants. But they will be available. There will be no cost associated with the flu shot. So we strongly encourage you to get the flu vaccine this year. That will potentially help us in helping to, limit the number of other infections that we may see that may be disguised as COVID, which, as you know, mimics, most flu or other respiratory-like illness.
And just as a quick follow-up, there's some questions of, do you have an idea when flu shots will be available? When will that process typically occur?
Usually early to mid-October, we'll have flu vaccine available on campus. Students will also be able to get vaccinated in the Wellness Center, so we'll advertise that. The events will be on ProfLink. There's a shout out to ProfLink. Please make sure you're checking that for all of the events that we have scheduled on campus. It'll also be advertised in the Daily Mail, so students will see when that's available. And again, we'll also advertise the off-campus clinics as well as they become advertised.
Great, thank you. So how about, I think this is a great question. Are your services available to commuter students, or is it just residential students that could take advantage?
Yeah, everyone. Yeah, everyone can access services, no matter graduate students, undergraduate, commuter, residential.
Yep, if you're enrolled and matriculated, you're eligible for services.
Great. Let me give you both a chance to breathe for just a second. There is a question out there about enforcement, and I think that's another great question. Lots of people asking, so what if people aren't complying? What if people aren't wearing their masks? And that falls mostly into my realm of responsibility as the Dean of Students. And certainly we have tried to do a number of things to educate students. These sessions, we have a PowerPoint presentation we expect students to look at, and lots of things happening to try to educate students about the importance of complying with policies and procedures. We have mechanisms in place for people to report their concerns in an online link format, but we will hold students accountable for not wearing a mask, and I think that's an important piece to understand. Certainly, we respect the Constitution, we respect all the freedoms that we have as United States citizens, but the reality is that we're in a pandemic, we're in a health crisis, and so we need people to understand that if if they're not going to comply with wearing masks, et cetera, then we would want them to be in a remote environment. We would want them to stay home and not participate in in-person sessions, and that's important. We have established great relationships with the neighbors in the community. Certainly we know all the articles across the country about college students partying and some of the social things that they're doing, and we're trying to educate students about that process and being very diligent. So if students have a concern, if parents have a concern, that report form is available to anybody, and we will address concerns that come to our attention. So thank you so much for that question. So Scott, talk to us a little bit about how these are great sessions, and certainly we're a week away from classes, and we as an institution, I think, have done a really nice job of trying to educate people before classes start. But what about the rest of the year? How will I as a parent know? Will there be some sort of dated posted saying, hey, these are COVID cases for Rowan? Will there be regular updates for parents and students? How will people know how things are going throughout the year?
Yeah, I think transparency is not only important, but I think critical, and for a number of reasons. I mean, I think first of all, we do our best to be transparent and make sure that good data is available. In public health, it is somewhat difficult because we are doing our best to protect individuals' privacy, and we're talking about COVID and illness. You're talking about medical care, and Amy and I both hold confidentiality and privacy very, very dear to what we do, because that's critical in maintaining the trust of our students. However, there are many things that we can and will share and are sharing. If you look at our Rowan Restart page right now, you're going to see our total count of known cases. And if you look at that, you might say, that looks pretty low, and I believe it is. I'm certain that there are a few cases that do not get reported, either because they don't call us. They happened in the summer and a student was away. So those numbers that you see represented in the Rowan Restart are a number of cases that have followed our policy and they've reached out to us, or the health department has notified us that we have a case, or another health department, to be quite honest. As you know, many of our students don't live traditionally in Gloucester County. So I've had to work with a number of health departments up and down New Jersey as cases have been identified. And they've all gone well, but those are other sources that we get information. We're also going to be tracking the percentage of positive cases that we test on campus. So that information will be posted as well. We have a whole team of people looking at other metrics that we're looking at to monitor, the health of the campus. So we're getting information daily from our local healthcare systems. I don't know if I mentioned that already, but so we're monitoring their ICU capacity and their ER visits as a metric to say, hey, there is some surrounding increased activity in terms of COVID, and it's something that we have to pay close attention to. We'll be looking at our isolation capacity and making sure we have plenty of rooms available. And if we start to lose that capacity, then we have an indication we may need to modify what we're doing. So those are some of the indicators, but we're definitely going to be posting as much information as we can and are allowed to post to be transparent. And we're happy to talk to anybody, any parents that call us. We're happy to answer questions to the best of our ability, as long as we're not violating that confidentiality and give them good information. At the end of the day, we want you to be comfortable. We want our students to be comfortable. We want to provide you with good information. Kevin, you're on mute.
Sorry about that. I've violated my own rule. So just a great clarification of the data that people are seeing on our website. Is that Rowan specific? Is that from their home communities? Can you put that data in context?
Yeah, so the chart that you see on Rowan Restart is any known case to a Rowan student, faculty, or staff member. All of those calls funnel into me and to our office here in the Wellness Center, and we're tracking them. And the contact investigation, we have an arrangement with the Gloucester County Health Department to do that. So we officially have deputized agents on our campus, professionals on our campus to help the health department do those investigations. So we are as connected as any university across the country with public health to monitor that. And like I said, that information is going to be transparent. We're going to continue doing these virtual sessions as well and post as much information as possible. And if all that's not enough, like I said, shoot me an email. I'm Woodside S. And I'll respond to you. And so we're going to be as transparent as we possibly can.
Great, thank you. Amy, a really good positive comment about the importance of group therapy and what the role that plays in students' lives. So can you talk a little bit about that in kind of a COVID virtual world? Will group sessions still continue? How will those look?
Yeah, so we have been doing group sessions actually over the summer already, and we have between 15 and 20 therapy and support groups that will go on in the fall semester. And then additionally, we have things that we're calling workshops that are run by either us or Healthy Campus Initiatives or Health Promotions Department. So we have groups that have very specific areas around, let's say, LGBTQ issues or grief issues. Actually, we have two grief groups going, one specifically for students who have been affected by, losses around COVID. We have anxiety groups. We have groups that have to do with, emotions and moods and depression. We have groups that have to do with depression and, coping skills that are more kind of skill-like and class-like, if you will. And then we have some general open groups for people to kind of talk about a variety of issues. So the way that you would access those if you're interested in doing a group, and again, I think the benefit of group, especially right now, is you will be with other people even though it will be virtual, it will be in a socially connected way. I think you can build community with groups that go beyond the group itself. So you would call, say you're interested. We're going to have, and already do have, the groups listed on our website. You can make an appointment to do what we call an initial consultation. We'll take some information from you. Again, this is all via telehealth appointments. So really, unless there is an immediate crisis where we need to see a person, in person, which we will do, all of our appointments will be via telehealth. And the way to access those is to call, and then we can set that appointment up for you. You will then get an email. If you opt in for text, you'll get a text reminder. You will go and you will check in. For those of you who have been to the Wellness Center before, you used to come in, you walk in, you check in at a kiosk, swipe your ID, put in your information. Now you can do that remotely on any personal device, your phone or a laptop. You'll check in, we'll ask you some questions, and then you will be directed to go back to your email and get directly connected to a therapist's room, WebEx room, a virtual room. You'll be in the waiting room, you'll be admitted, just like you might be when we come out and get you if you were here in person. And then you'll be able to spend about 45 minutes with that clinician and get some information. If you're interested in one of the groups, or if we recommend one of the groups to you, then you'll be contacted by the group leader for that group. You'll be given a start date, a time, and again, you'll be able to access those groups via WebEx, and the link again will get sent to you through your email so that you can access that. And those generally, the groups are run at the same time each week. Some are for the whole semester, some are like a 3-session, again, workshop or class. And then we have more social groups that are run through our Healthy Campus Initiatives. We have a group called Chill and Chat that's been running for several years. That's a great way to meet new people. And again, we're gonna, try to do things in a hybrid way here. So for a time where we might be able to be outside in a socially distanced, fashion, or physically distanced fashion, we might be able to do some things outside with masks and, at that distance. Otherwise, it will be virtual in nature. We play games, we have conversation. I think, again, it generates kind of good community, which goes beyond the virtual world. And then we also have some, I think, groups that are specific for our students of color, for students who might identify as queer or LGBT. We have a series that's run by one of our counselors, Kai Sadler. She's a psychologist, called You Good Fam. And some of these initiatives are kind of co-sponsored by Student Life, Student Affairs. So these are dialogues. They're both education series, and then there are dialogues for students who kind of want to talk about their experience as students of color, in the world right now. So I think there's lots of ways to get connected to something here. In addition, we are going to have a weekly yappy hour through our pet therapy program. So whether or not you have a pet, or an animal in your life that you want to bring to that session, it does not matter. If you are just a lover of animals or would enjoy getting connected to people, but that might be a good way to start the conversation and talk to people, you can come to the pet therapy yappy hour weekly. You can also schedule kind of the same way virtually, or in person. We will be doing in our kind of yard next to the Wellness Center here. If you've actually seen it, we'll be doing individual pet therapy visits with Michelle, the Associate Director of our pet therapy program. So again, I think lots of ways. If you're feeling alone, if you want to, feel less anxious, pet therapy has been researched to kind of really help with that. We know just touching an animal and petting it releases lots of good, hormones that are stress relieving. And same way, I think, as I've said, kind of groups do. We know that loneliness is actually something that actually impacts physical health. If you look at the research on loneliness and social disconnection, it's like actually smoking 15 cigarettes a day. So if we can build resilience and build our immunity, not just, again, avoid things, I think we're all the healthier for it. So any way we can help with that.
Great, thank you so much, Amy. So Scott, let's dig just a little deeply into some of the questions that were often answered. One, there's a question of, can you remind us again, what percentage of the population are you looking to randomly test on a weekly basis, and can that increase if you decide you want to do more at any given time?
So the answer is absolutely yes. We could increase. That is that we're actually using the saliva test for that, knowing that most students will not want to stick something up their nose voluntarily unless they have to. So that is a saliva test kit that we're purchasing. We purchased a large supply right now. We can certainly expand or contract that. Our main focus is going to be on the symptomatic surveillance, but by the end of the semester, we'll probably have tested somewhere around 20% of the population in an asymptomatic way. So we're looking somewhere 1% to 2%, 3% a week, and that's going to be a weekly process. So we're going to continue with that, and we're going to monitor it, and it's one way that we'll look to assess. I mean, our main focus is going to be on identifying those that are symptomatic, but we have to have some asymptomatic testing because we know that COVID can be spread from our asymptomatic folks as well.
Great, thank you. And you and I both know one of the most common questions that we get asked is, what's the threshold? So tell me the magic number that says if this happens at Rowan University, then the university is going to close. What's the process we're using there?
Yeah, so there's a couple magic levers that would get pulled, right? So the governor says you're going back to phase 1. That is the first lever that gets pulled. If that happens, then it's out of our control. That means that there's some widespread COVID activity in New Jersey, and the governor is making a decision to do what's safe in his opinion. So that's number one. Number two, if I start seeing a number of outbreaks on campus that aren't related, I'm not talking about if there's a party off campus and identify 15 students that attended that party. We'll be able to identify and contain that. If we're talking about an athletic situation where once our teams start practicing and we have an entire offensive line that is, so those are scenarios that we are planning for and can contain. If our ICU capacity in our local hospitals are now full, that could even be a trigger. So there is a number of triggers that we're looking at. If we have a positivity rate, if you recall at one point in New Jersey, the rate of positive tests were somewhere around 44%. Right now, the positivity rate is somewhere around 1-2%. If we start creeping into double digits with a positivity rate with what we're doing on campus or in this area, I'll start to get concerned at that point. But there's no real magic number there. And Kevin, you're right, we get that question a lot. But I try to answer it that way is we're looking at probably 15, 20 different metrics that we're looking at to evaluate that decision. But really, ultimately, we're going to get together, all of our leaders will get together, we'll say, can we continue the level of safety that we believe that we have? And if the answer is no, then we're going to modify operations. The president has been very clear. He is not doing making any one decision because he feels he has to. It's because what is the right thing for our campus, our students, and our faculty and staff.
Great, thank you so much, and I want to reiterate that there's so many people that meet multiple times throughout the week with that very mindset of how do we use data that's specific to Rowan, that applies to us, so that we're making great decisions. We know that our students have lots of unique needs. We learned a lot in the spring, and some of our students just couldn't function in that environment. And so we're always going to put safety first and foremost, and that's paramount to us. But as long as we can in a safe environment, we know that some of our students absolutely need the resources that we have on campus, be they technology, be they mental health, be they physical health. There's so many things that happen on campus that are important. So remind us again, there's a great question of remind us. So if I am either in a quarantine or an isolation situation, do I have to go to Triad, or can I do that in my own room? How does that work?
So if you're talking about isolation, that means a confirmed case or a case that's pending confirmation. We're not allowing students to remain in their residence halls, even if they have a single room. And the fact of the matter is, if we're that concerned, if our level of suspicion is such that we feel this potentially is a case of COVID, we don't want that person walking around that building, even if they do it unwittingly or without any malicious intent. So we're going to protect them. We're going to protect our campus by moving them off campus or on the Triad if for some reason that student can't go home. So it's different if you're quarantined. If you're quarantined because you were a known contact or you come from a state that has high incidence, you can do that in your room safely. The policies we have in place in residence halls is if you leave your room, you should be wearing a mask. Everything except taking a shower and brushing your teeth. I think that was the joke at one of the other virtual gatherings. I don't expect you to wear a mask when you're brushing your teeth. And if you do, please take a video of it and send it to woodsides@rowan.edu because I'd love to see it. So that is the main difference. Yes, if we have a confirmed case, that case needs to be removed from the general population. And that's, again, to protect both them and us. And they will be monitored. Again, it's not like we are putting someone in Siberia and hoping them well. We are going to have multiple redundancies of follow-up with those individuals, and as soon as we can get them out of isolation, we will, but not a day before. We're going to follow the public health guidance on that.
So the question as a follow-up is, it talks about, what about roommates? So we talk about, Kevin might have some symptoms. He might be going through the protocol. Well, what happens with the roommate? When are we concerned about a roommate? When might we do some things with contact tracing or have expectations of roommates?
Yeah, so if there is a known case that does have a roommate, we will certainly talk to that roommate as well. We'll give them good information. We'll encourage them to do what we ask them to do in terms of quarantining. They will be able to remain in their room, but we are going to ask them to pay extra attention. We're asking every student across the campus and faculty member and staff to monitor their symptoms every day, and every day they have to attest that they do not have a fever or symptoms or have been in contact within the past 2 weeks. So that'll have to happen, but we'll extra emphasize that. So there is a burden that we're putting on all of you, just like we're asking you to wear a mask. We're going to burden you with this accountability of making sure you are protecting others around you. If we identify you as a close contact, please respect that and make sure you stay in your room unless you absolutely have to go out. Make sure you wear a mask. Students that are quarantined, they can wear a mask and order Grubhub and pick it up and come back to their room. But outside of that, they should be staying in their room. They should not be attending classes or events in person. So it's very important. And we'll give them that good information if we do identify them as a quarantined or a close contact.
Yeah, and I think that's an important clarification that sometimes when we say that students who are on quarantine might be around, that is just kind of what we call the life critical pieces of, they might go get food, or they might have a doctor's appointment off campus, or they might have to go to the pharmacy. It's not that a quarantine person, we give them good guidance of, we need you to stay in your room, we need you to monitor in case you become symptomatic. It's not that you get to go around campus, and in all these these cases, whether it's isolation or quarantine, we're notifying faculty members. We don't violate any confidentiality, but we notify faculty to say, hey, Kevin won't be in class for the next couple of weeks. And that's common. That might be if Kevin has appendicitis. That might be if Kevin, has to have surgery. There are a number of reasons why somebody might have to miss class. So we're not going to violate people's confidentiality. We're not going to have our COVID list that people can refer to. We'll do that in a very sensitive and secure manner, but students, their faculty will know that they are not to be in class and be able to do things remotely. There's a question about off-campus. So I use the term easy loosely, but it's a little easier to monitor an on-campus student, and we've got some resources. But what about off-campus? What if I'm a student who's not feeling well off-campus, or maybe I'm in quarantine or isolation off-campus? But what resources do I have there?
Well, if there's a student that lives off campus that needs to be isolated, they will certainly be eligible to use the on-campus isolation process that we have in place. So that's first and foremost. Secondly, as Amy had laid out, all the resources that we have available to them in the Wellness Center will still be available to them. A lot of our resources we have put in a virtual capacity, so all those will be made available. The student life and all the activities through there, they'll be able to access virtually while they're quarantined. So any resources that are available in a virtual environment, they certainly will have access to. I think that's critical. I think a lot of times commuter students, anyone that lives off campus, feels like they can't access or they can't do certain things. I can tell you that they certainly do. They have access to everything that a residential student would be made available to them as well.
And there is testing, right, Scott, that students can access, and we have a list of testing sites like Rite Aid and CVS. If students who are asymptomatic and want to get tested, they can do that.
Absolutely. Yeah, so we'll make all that available. We have some information sheets here that we can send to students that inquire, but the covid19.nj.gov is a great place to, if you don't want to get tested through us, there are plenty of testing resources in the area. I'm actually helping Gloucester County getting their testing program started again. So in a few weeks, there'll be some drive-through testing sites available in either Clayton, Mantua, or Swedesboro in Gloucester County. So a lot of resources available for testing, and that'll be available for symptomatic or asymptomatic individuals.
I would say that goes for mental health resources too. We have a partnership with a variety of providers who are within walking distance. In Spira, behavioral health care is right across the street. And if for whatever reason students don't want to come to the Wellness Center for services, or they require a kind of different level of care, or at some point they want something that we're not recommending or can't give them, we can make direct referrals to those agencies and get them connected to services as well. Some of those places have in-person mental health services happening right now in addition to telehealth. So depending on a student's preference, we can get them connected to the place that's right for them.
Great. I'll give you both a chance to breathe for just a second. There's a question about, how will we handle things in residence halls if maybe a student doesn't know their roommate, or if they're coming from a state that has a quarantine advisory. Yes, we have some trained staff. Obviously, we train them very thoroughly every year. This year, certainly, we have given special attention to COVID training and how to deal with the sensitivity of that and some of the unique things that come along with COVID. But our staff will maintain contact with people in their residence halls. They're not only do they need to get to know them, but to reinforce policies, procedures. Again, even outside of COVID, we have staff that we will encourage roommates to have conversations of, what are your expectations about having guests over? What are your expectations about, lights on after midnight, and, what we call roommate agreements, basically just kind of life skills of, if Scott and I are roommates, just getting to know each other and understanding of, what are my study preferences? What are my relationship preferences where I might have a guest over to visit and play video games or something. And, so making sure we're having those conversations, those happen on a regular basis, on a daily basis. With regard to quarantine, we are monitoring students who are coming from states where there's that advisory. And as Scott had said before, everything is situational, but a lot of it we have kind of a two-survey process. That if somebody is telling us that they've had some sort of symptoms, then we're treating that very differently than if somebody just has to meet an administrative requirement as a quarantine. If somebody's coming in, they're not symptomatic, they're not showing any signs of concern, then obviously they would quarantine in a different way than somebody who would say, I've had a fever in the last 2 weeks. We have a series of questions we ask. So we're being very diligent about that process and making sure. And Scott, you may want to add in there, but I think the process we have is very thorough and really trying to make sure that we're quarantining people in a way that's compliant with the governor's orders, but also, most importantly, paying attention to safety and security of our students.
Yeah, no, you said that very eloquently. Yeah, so there was a couple questions regarding students in rooms. Kevin, you may be able to speak to this, but my understanding is the policy is you're allowed to have one visitor in your room as long as your roommate is agreeable to that visitor.
Correct.
That's the policy that we have in place during this COVID period.
Yeah, and certainly, obviously, what's happening with move-in is a little bit different. We know that people can't be expected to move all their items in by themselves. So you might have family members or guests. We often get the question of, hey, can I have my mom and dad come over if we're in COVID world? Yes, that can happen. Well, we just want to try to limit. And certainly, please know, we're not trying to restrict relationships. We're not trying to restrict people visiting. We just want to, and Scott says this a lot, and I really like what he talks about, is we want to try to control the unknown factors as much as humanly possible. So if Scott and Amy and I are considered a household, well, obviously, we're less concerned than if Scott and I have, if he's from a state that's of concern and he's coming over all the time. Well, that's different than if we have kind of known scenarios. So when we have our guest policies in place, it's more to control for the unknown factors. It's more to promote low risk behavior from that standpoint versus saying we don't want people to have guests or visitors. So that's an important distinction and clarification to make. Question of, and I'm sorry, I was just reading this here. Scott or Amy, I don't know if you know the answer to this. Somebody's asking for the rationale of why are we bringing people back after Thanksgiving. There are some schools who have said, look, we're going to go to Thanksgiving, and once we send you home for Thanksgiving, we're not coming back. Thoughts on why we're not doing that?
Yeah, actually, many universities a few months ago, as we were monitoring the different universities, decided to actually start earlier. So they moved their semester up a few weeks in the plan of shutting down a few weeks early. We decided not to do that intentionally for a number of reasons, and actually I'm glad that we did not. We were just maintaining this flexible mentality because, as you remember, 2 weeks ago, most of the country, it was a hot spot. So now you're dealing with even possibly more infection rates that people are bringing to campus in that scenario. So we decided not to make any major adjustments there, in addition to some academic reasons why we didn't do that. But the short answer is we could always move to a virtual environment after Thanksgiving. So if we're heading into November and our metrics that we're studying are trending upward, we'll make that decision and we'll go to a virtual environment at that point. If we're seeing that people are going to go to homes where there's states where there's a high degree of infection. And the other thing to know too is Rowan University is roughly 95-96% New Jersey. So we didn't feel that was a huge impact in our population. So believe me, that is a decision that we did not make lightly. We weighed that out very heavily as to whether we should modify our academic calendar and make that adjustment. But at the end of the day, I think we erred on the side of stability and flexibility, which is where we settled on maintaining the same schedule, knowing that we could always flip.
Yeah, and I think that we receive lots of questions about why are we doing some things that might be different than other institutions, and certainly all institutions are different. But one of the things that I'm really proud to be associated with Rowan is from the standpoint of since day one we've built in that concept of flexibility and agility. We certainly know that there is no one size fits all. There is no perfect answer to many of the questions that we're getting, and I would say compared to any other institution certainly that I've been at. Rowan is prepared for as much as you can humanly be prepared for shifting very quickly. As Scott said, if data says, look, you shouldn't come back after Thanksgiving, we can adjust and shift pretty quickly about that. But we can use real-time data for that as opposed to trying to make a prediction today of something that may or may not be true 2 or 3 months from now. So I think that's important. Who will be, so can we talk a little bit about cleaning protocol? You know, one of the things that people are really concerned about is what's happening with cleaning. So can you talk about that process at all?
Yeah, absolutely. So our facilities team is on that emergency response team that Kevin and I both sit on, and they've done really amazing work. They've actually not only gone above and beyond, that we're outsourcing additional cleaning resources to make sure that we can adequately clean multiple times a day, and make sure we're deploying cleaning available resources. So every classroom is going to have available resources to wipe down desks and areas when you're done with it or when you start a classroom. In addition to the thorough cleaning, they're going to get multiple times a day. Touch surfaces are cleaned in addition to those thorough cleanings in all of the classrooms and bathrooms multiple times a day. We've invested heavily in electrostatic fogging machines. So I can tell you we've got many departments across campus that have them, and we're deploying them in targeted areas where the arts is one example. I know there's a couple questions about the arts and how we dancing. I can tell you Rick Dammers is one of our amazing deans here at the university, and I've had many conversations with him. He's studied COVID and the research related to the music and the arts and dancing, and if it's ever humanly possible for us to bring all those things together, Rick Dammers will find a way. He's actually, experimented with putting surgical masks on trumpets and trombones, and so he's doing everything humanly possible he can to make sure that if we can re-engage the arts in a way that resembled what it looked like pre-COVID, we're going to do it and do it right. He also has invested in some fogging machines because he's got many spaces in Molson Hall where people do practice their vocal skills. So they're waiting a period of time. We're fogging the room, and then we're reopening it once that period of time that we've determined is reasonable there. So trust me, there's a lot of measures that we're putting in place. There's a lot of signage. I'm laughing walking around looking at the signage we have on campus. The best one I've seen so far is we're going to party like it's 1918. Talking about the mask and the pandemic from 1918. So. Yeah, so we're doing our best to make it welcoming and homey, and at the same time put good public health measures in place.
Great, thank you. Question is, that's a mask question. So the question comes, when can commuters pick up their masks? Starting at the end of this week, actually, there'll be an email going out from me tomorrow to commuters and those students who are not in residence halls about how to pick up their masks. So that process will be coming out and be outlined, but that'll start at the end of this week. Question, I don't know, Scott, if you have the answer. Have any changes been made to improve ventilation? Feel like that some research out there about ventilation may have an impact on droplets, etc. But any knowledge about what's been happening there?
Yeah, so I can tell you every HVAC filter has been upgraded to what's called a MERV 13. So it's a much more sophisticated hospital level filtration system. That's just one component. We know that wherever we can add ventilation, wherever we can pump more fresh air in, we're doing it. So every space that our facilities team can expand the amount of fresh air we're getting, we're doing it. Windows that can open will open. The filters, the fogging machines, so all those are in place to address the ventilation system. it is a variable. Ventilation is certainly a variable. That's why we're trying to move many things outdoors. You're probably going to see when you do have in-person instruction, some professors will be doing some activities outdoors, all by design. I mean, outdoors dilutes the amount of potential concentration in the air. So it's important that we do many things outdoors. That's why there's no indoor dining yet. That's why we're de-densifying and spreading things out. So that is important. Ventilation is something that should not be ignored, and we haven't ignored it. We've also deactivated all of the water fountains across campus. That's something that people don't even think about. We've actually had to bring plumbers in and rewire the fountain so that the fill bottles can still work, but the regular drinking portions are shut down. So all those little details that our team has really put in place, they've really done an amazing job. And listen, that's not to say that you're going to come to campus and you're going to see something that you don't like or doesn't make sense. If you see something that doesn't make sense, please let us know, because we want to address it, because believe me, that is not the plan. The plan is to make sure that bathrooms are clean, touch surfaces are clean, there's good signage everywhere, water fountains are turned off, HVAC systems have been improved. But if you're seeing something that doesn't make sense or is contrary to what you've heard at this session or other sessions, please let us know. You've got 3 contacts here. You can email the president's office. You could email facilities, anybody, dispatch, Mike Cantner and his team at Public Safety. Someone will respond to you, believe me. So let us know.
So just to clarify, there's a question. If I am using a water bottle filling station, I can do that at a water fountain, just not use the button process.
Correct.
That's the official term, right? The button process.
It's essentially no touch. Those are sensors. You put it up, it senses your bottle, it fills it up. You don't have to touch anything.
Great. So I don't know if you know this, and I can certainly try to answer as well, but somebody asking us before we end the session today, can you talk about the first 4 weeks of school? Are those going to be virtual? Are those going to be in person? What's going to happen the first 4 weeks of school?
That's a great question. Again, that's probably more on the academic side. I can speak to, let's start with the Wellness Center, and I'll work out from my circle. In the Wellness Center, we never shut down. Amy and I have been here virtually every day, outside of, when we were away or we're running testing clinics. We've been operating, and we've been doing mostly virtual work, but this building has been open and will remain open. On-campus events, Kevin and his team in student life have done amazing work in preparing for that. I walked through the Grove outside today, preparing for the food truck festival and everything else going on. There's lots of activities happening with social distancing, but lots of in-person and virtual activities happening. Classrooms are going to be dependent upon each individual college, so you will get specific information from your professor on how your classes are going to go. You probably already got information about whether a class is going to be virtual or in person. If it's in person, it's going to potentially be staggered depending on the space availability. So all those plans are being worked out on an individual level with each college, dean, professor. So that'll take place. You're probably going to see more virtual classes at the start of the semester, and then we'll phase in more in person. I mentioned before some strategy, maybe a class may be taken outside, things like that. So you're going to see that, and you're going to see that variability. And just so you know, we've talked about flexibility. You also need to be flexible, because a class could change in a heartbeat. Let's say a professor now is quarantined or is a known case. So they're going to be able to do their teaching remotely. So your class will now be remote, right? That's just an example. So you need to be flexible in addition to our system and our professors and our team here.
Yeah, and I think that's the important piece. Again, as I've said throughout the session, it's unfortunate. I think some of the negative press that college students are getting, but I think the important piece throughout this whole session is to understand. Yes, there are lots of responsibilities that we as an institution have, and certainly have done a lot of things with our cleaning protocols, with the policies that we've changed, with de-densifying our residence halls, the number of things that we've done. But the really important piece again is that students also come with the mindset of there's a responsibility of letting us know if they don't feel well. Don't go to class if they have in-person classes. Don't go to class if they're not feeling well. Of having a supply of wipes and sanitizer in their room so that they can clean doorknobs themselves, or following good hand washing and hygiene protocol. The number of things that were presented in the PowerPoint presentation that all the students had to look at, I think are critical of, how do we partner about this, doing this together? How do we not say, oh, it's the student's responsibility, or it's the university's responsibility? This is all of our responsibility to make really good decisions and to help one another be successful. I really believe in my soul, and this is not propaganda. I think Rowan can set the example for every other institution across the country, and I think we've got the model in place to do so. We just have to each assume our own personal responsibility to do that, and I think we can do well. What happens? So what happens, just real quickly, if somebody does feel symptomatic? Is there a number that they should call? What steps should they take to, I know we talked about this a little earlier, but let's just remind people, what steps should somebody take if they're feeling symptomatic or they're not feeling well?
So really, it's the same thing. I think we should treat this really the same way as you would treat, well, maybe that's not exactly true. So we want an extra level of attention paid to this. That's why we're asking you questions every day, right? Do you have a fever? Do you have symptoms? Have you been exposed? But I want you to treat your illness like you would treat other illnesses, right? So if it doesn't make sense to you, if you're not feeling well, you need to do something about it, ultimately. So what we're asking you to do in this situation is, we have symptoms of COVID. If you have a fever, cough, shortness of breath are the three main indicators. If you have a sudden loss of taste or smell, or if you have some other symptom that is not normal to you. So let's say you have asthma and you're chronically short of breath, and you're short of breath and because you don't have your inhaler. That's not necessarily a symptom of COVID. But if it's different, if it's a different situation, you have a profound shortness of breath, meaning you can't walk from the couch to the bathroom without shortness of breath. It's not Scott Woodside who's out of shape and can't run up 2 flights of stairs. So think about your symptoms. And if you don't know, call and ask. I have nurses that will be here. And if not, we will respond to you. If for some reason they don't answer right away, we will get back to you, believe me, and we'll help you through that. Your RAs are trained to help you through that. We have EMS 24/7 if you're that concerned about your health and well-being. But really what we ask is that you call us, you call our partners at Urgent Care, at Inspira. You get access to health care if you feel that you need it, and you stay away from people if you're sick, as Kevin just told you. So please, 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 I can't stress that enough. We're not forcing you to come to class. In fact, I just told you every class is virtual. There are some situations where labs that we know are experiential and you have to be there. Work with your professor on that. Our professors have been told, they have to have some flexibility built in, and they know that this is extreme circumstances. So they'll be willing to work with you, but keep your distance, wear your mask, stay healthy, stay hydrated, get rest, and try to do the best you can. If I ever call you, the answer to the question is, were you within 6 feet of someone for more than 10 minutes, your answer should be no. So that is key to remember from my speech today.
And the number to call is 856-256-4333. That's the number to the Wellness Center. After hours, if you call that number, you can press 3 and it will give you information on how to access public safety or an on-call counselor after hours. But, just like everyone else, I think students may want to just kind of walk in and ask questions at the Wellness Center. And we're really encouraging people to call first, because again, if you have some concern especially about symptoms, we want to protect everyone, including us, because we want to keep being able to serve the student body here and the faculty and staff. So really think about that call so we can screen you and then get you connected to the service that you need.
Great. Thank you both so much. As we come to close for this session, and again, if we didn't get to your question, please feel free to reach out to one of us. We certainly didn't mean to miss your question, but if there's something that we missed, reach out to us. We'll happily answer that in an online format or an email format. Certainly continue to look at the webpage. Lots of good information there. But Scott and Amy, just kind of your last words of advice to somebody. If I'm a if I'm a parent or if I'm a student coming to campus and I'm really excited to start the fall, or I'm nervous, or I don't know what to do, I don't know if I should go online, what's your best advice for me to have a great experience for fall of 2020?
I mean, I'll start and I'll say, really, I think we need to embrace it. I think that these are once in a lifetime times we're living right now. No one can change, and the fact that we are going to be getting through this speaks to resilience, speaks to our stick-to-itness, speaks to our ability to overcome. So I would embrace that. I mean, you are the generation that is going to be getting your college education during a pandemic. That is something that is remarkable. We believe that you can do it. We believe in what we've done here. We believe that if Kevin has said, if we work on this and we assume that responsibility together, I have no doubt that we'll get through this. I am very, very heartened by what I've seen so far, really starting over the summer with our commencement. We pulled off commencement over the summer, really when everyone was doubting whether or not we should do it. It was an amazing experience. I personally drove a golf cart for 3 days straight. I had some great experiences meeting with families and students. And then we were going through move-in, and I could tell you move-in has gone fantastically well. The university has really tried to put as many resources as we possibly could to make this successful. And I have every hope and belief that we will be successful. And whatever that success looks like, I know we can accomplish it. So I'm grateful, I'm hopeful, I'm energized that I'm starting to see students on campus again. Amy and Kevin and I have been very lonely coming to campus every day. So we're excited to see your faces back here. I know the president says there's a lot. He loves seeing, all of our young faces and the energy that brings to the campus. So I'm looking forward to that. We're here to help. Don't hesitate to reach out, and we'll be a resource, and we're in this together.
And I would just add that I think, again, if we think about well-being and the 6 components, physical, social, community, purpose, financial, and emotional, the culmination of that, as Scott was saying, is we can embrace it and be a model, I think, for other schools on how to create community around this issue, right? How do you still thrive and have a great experience, whether you're a freshman or a senior or in between at Rowan, and make the most of these college years and learn adaptation. I mean, that is going to be the skill that is going to serve you best in your life, wherever you are, whatever you do, being able to adapt and be flexible and connect with people. So if you have an idea about how to do that, let's get creative. Bring those ideas to us, to student life, to your RAs, to your department, whatever class professor that you're involved with, because I think the more you are engaged in actually creating solutions and making it the best year possible, that's how we create community around this, and we stay healthy and excited and our best selves. So
And that's amazing, and I will echo what Amy was just saying. Part of it's in our mission and our values as an institution that we're resilient. Profs are resilient, and certainly we've proven that time and time again. But this is now the time where we're going to be innovators. We're going to be the leading edge. We're going to be that resilient force that's going to do lots of great things. But I would offer 3 pieces of advice. 1, speak up. If you've got a concern, share that thought, share that idea. Don't hold it to yourself. Let us help you. Do your part. As we talked about before, we've all got a responsibility here, whether it's faculty, staff, students, parents. Do your part, and we'll be successful together. And the last thing I would say is just have a lot of grace. Grace for yourself, grace for others. I promise you, we're all trying our best. We all are working really hard, and sometimes we're going to make a mistake. Sometimes we'll have a misstep, but hopefully we'll offer each other grace. Certainly give yourself grace that again, you're going to make mistakes and things are going to happen, and that's not a time to beat yourself up or to feel badly. It's the time to ask good questions and to move forward. So I think grace is going to be an important part of how we move forward as well. So want to send a sincere thank you to Scott and Amy. You both are amazing. You touch my heart every day, and I really appreciate what you do for students, what you do for this community. Just thank you so much. And for those of you who don't know, and I'm getting a little emotional here, and I apologize for that, but for those of you who don't know, these folks are here 24/7. They are just cranking it out, and lots of really special people across the campus. Rowan is just an amazing place, and again, I'm not saying that for a brochure item. We've got incredible people here, but these folks have been just cranking it out every day for our students to make this better. So I want to personally thank each of you for the time, the effort, the sacrifice you are making to make this place not only safer, not only more low risk, but just an awesome place for our students. Thank you so much for what you're doing for us. And I want to just thank participants. Thank you for being here. We couldn't do this without you. Your questions are critical. Your questions make us think. They make us challenge ourselves to make sure that we're getting better. So thank you for participating. Thank you for being a part of the process. And we look forward to working with you and your students in the fall. So y'all take care. Thank you so much. Be safe, and we will see you soon.
Thank you, everybody. Thank you, Kevin.
Thank you, Kevin.